You've probably seen the whispery questions late at night. What happens to your body, especially your prostate, if you masturbate every single day? There's a ton of fear-mongering out there, rumors that it can cause inflammation, damage, or even cancer. But today, I'm cutting through the noise, and the truth is almost certainly not what you've been told. Let's start with the prostate itself. It's a small gland, about the size of a walnut, nestled just beneath the bladder, in front of the rectum. Its main job, to produce the fluid that nourishes and transports sperm, forming semen. Despite being small, it plays an outsized role in a man's health, especially as he gets older. And because of that critical role, there's a lot of anxiety surrounding it. The myths you've heard about frequent masturbation wearing out the prostate or leading to chronic inflammation or packing some hidden risk for prostate cancer sound scary. Prostate cancer is one of the most common cancers in men, so understandably, many of those concerns have some emotional traction behind them. But here's where the real story begins. A landmark study from Harvard, yes, Harvard's incredibly respected Thorpe School of Public Health, put these fears to the test. They tracked nearly 32,000 men over nearly 20 years, collecting detailed data about their lifestyles, habits, and prostate health. One key factor they looked at? Ejaculation frequency. And the results were astonishing. Men who ejaculated more frequently actually had a significantly lower risk of prostate cancer. Specifically, those who reported 21 or more ejaculations per month through masturbation or sex showed up to a 33% lower risk of developing prostate cancer compared to those averaging just 4 to 7 times per month. That's not a small trend. That's huge. This isn't a one-off. Other research supports the finding, including a major Australian study that echoed the protective link. Suddenly, those common myths flip entirely. Rather than causing harm, frequent ejaculation appears to be linked to prostate health, potentially protecting against cancer in ways we're just starting to understand. So why does it work? Scientists have a few theories, and they all make biological sense. First, there's the prostate stagnation hypothesis. Imagine the prostate's ducts as tiny pipes. If they don't regularly flush themselves out, debris, old cells, and potentially harmful substances can build up. Regular ejaculation acts like a natural flush, keeping these pipes clear. Second, there's the cell cycle theory. Each time a cell divides, there's a chance for genetic mutations. Ejaculation may stimulate healthier cellular turnover, replacing old or potentially damaged cells before they turn malignant. Lastly, there's the stress and inflammation angle. Ejaculation releases tension and calms the mind, reducing stress hormones like cortisol. And since chronic inflammation is a major risk factor for cancer, lowering stress may help the prostate maintain a healthier environment. Taken together, the data and theories create a compelling picture. Daily masturbation or regular ejaculation through any means can be part of a healthy routine for prostate protection. It's not some bizarre loophole, it's simple, natural, and backed by solid evidence. But the story isn't just about preventing cancer in the distant future. What about the irritation or urinary symptoms that some guys struggle with right now? Like waking up multiple times at night, feeling like they can't fully empty their bladder, or dealing with a weak stream. For that, there's a different, targeted solution. I'd urge you to check out a short, fascinating presentation about a natural spring water juice remedy rooted in an unusual Asian herbal formula. It's designed to clear what some call a hidden prostate clog, addressing exactly those symptoms. You'll see a QR code on screen. Point your camera at it to watch immediately. Continuing on prostate health, it's incredible to see how something so simple as ejaculation frequency aligns with well-established science and common sense. But before you declare it a cure-all, we need to be clear. This science is correlational, not proof of direct causation. Men who ejaculate more often may also lead healthier lives overall. They may exercise more, eat more nutritious diets, avoid smoking and excess alcohol, and be generally more proactive about their health. The ejaculation finding is a powerful piece of the puzzle, but it's certainly not the entire puzzle. So while masturbation is a valuable tool, it's not a replacement for a holistic approach to health. Diet matters a lot. Fruits, vegetables, healthy fats, lycopene-rich foods like tomatoes and watermelon, green tea, and omega-3s from fish all support prostate health. Exercise is vital too. Maintaining a healthy weight and staying active helps reduce the risk of aggressive prostate cancer. Lifestyle choices matter. Smoking increases cancer risk and impairs blood flow. Alcohol should be consumed in moderation. And none of this mitigates the need for regular medical checkups, especially after age 40 or 50, or if you have a family history. PSA blood tests and doctor checkups remain essential for catching early warning signs. So, to circle back to our original question, what happens to your prostate if you masturbate every day? The science is clear and surprisingly encouraging. It's not only safe, it may even reduce your lifetime risk of prostate cancer by as much as a third. It's not a magic bullet, but it's a low-cost, side-effect-free tool in your health toolkit, an easy method to support prostate wellness in the long run. So now that we've shattered one of the most persistent health myths surrounding masturbation and the prostate, let's step back and look at the broader reality. Prostate health isn't just about one habit. It's about a system of small decisions that collectively make a massive difference over time. That's why, if you truly care about your long-term vitality, you need to think beyond just how often you ejaculate and start paying attention to the full picture. Let's begin with food. If you've ever wondered whether your daily meals can actually impact your prostate, the answer is a resounding yes. Studies consistently show that men who eat a diet high in vegetables, fruits, legumes, and healthy fats tend to experience fewer prostate issues. Lycopene-rich foods, such as tomatoes and watermelon, are a key part of this. Lycopene is a powerful antioxidant that seems to concentrate in the prostate gland and help fight cellular damage. Cruciferous vegetables, like broccoli, cauliflower, and Brussels sprouts, also play a powerful role thanks to compounds that support hormone balance and cellular detox. Then there are omega-3 fatty acids, often found in fatty fish like salmon, mackerel, and sardines. These fats reduce inflammation throughout the body, including in the prostate. And remember, chronic inflammation is a silent enemy. It doesn't just show up in swollen joints. It creeps into organs like the prostate, disrupting healthy function and setting the stage for disease. Drinking green tea, which contains anti-inflammatory catechins, has also been linked to lower prostate cancer risk. Even something as simple as swapping red meat for plant-based proteins a few times a week can lower systemic inflammation and help maintain a healthy weight. Speaking of weight, now let's be honest. None of this is as easy as it sounds. Life gets in the way. Work, stress, bad habits, social events. It's easy to put your health on the back burner. That's why it's important to start with what you can control. Something like adjusting how often you ejaculate isn't hard. In fact, it can feel natural. It doesn't cost a dime. You don't need a gym membership or a fancy diet plan. You're simply giving your body a healthy, instinctive outlet that helps it clean house and reset. But you shouldn't stop there. Masturbation might help your prostate on a cellular level, but if you're still filling your plate with processed meats, smoking cigarettes, and skipping your annual checkups, you're missing the forest for the trees. Everything you do matters. That includes your mental health, too. Chronic stress isn't just about mood. It affects your immune system, increases inflammation, and can even mess with your hormones, including testosterone. Activities that lower stress, whether it's meditation, deep breathing, or a relaxing hobby, can benefit your prostate just as much as a bowl of broccoli or a jog around the block. And then there's sleep. Poor sleep affects hormone levels, blood sugar, weight, and inflammation, all risk factors for prostate disease. Adults should aim for 7 to 9 hours of quality sleep per night. If you're waking up frequently to urinate, that could be a sign of an enlarged prostate or other urinary issues, and it's worth getting checked out. And don't ignore red flags like blood in your urine or semen, persistent pelvic pain, or a sudden change in urinary habits. These aren't just annoying symptoms. They're your body's way of waving a flag. Listen to it. This brings us to the single most powerful tool in your prostate health toolkit: early detection. No matter how healthy your diet is or how often you ejaculate, you still need to visit a doctor. Men over 40 should begin regular screenings, especially if they have a family history of prostate cancer. The PSA blood test is simple, and while it's not perfect, it's one of the best ways we currently have to detect issues early when treatment is most effective. Let's revisit the biggest fear here: prostate cancer. It's common, but it's also very treatable if caught early. The problem is, many men are embarrassed, misinformed, or just too stubborn to make that appointment. Don't be one of them. You take your car in for oil changes. You schedule dentist appointments without flinching. Treat your body with at least the same level of care. Your future self will thank you. All of this paints a clear picture. Masturbation, far from being the hidden villain it's often made out to be, can be part of a healthy, informed routine that supports your overall wellness. It's not taboo. It's not shameful. It's a normal, healthy behavior that plays a direct role in flushing out the prostate, supporting cellular health, and managing inflammation. Of course, balance is key. If masturbation is interfering with your relationships, work, or sense of well-being, that's a different issue, one that requires attention from a mental health professional. But from a purely biological perspective, regular ejaculation is a green flag, not a red one. So the next time you hear someone say that masturbation is bad for your health, you'll know the truth. It's one of the simplest, most natural acts you can use to support your prostate.